Madam President, thank you very much, and thank you, Senator Merkley. I'm pleased to stand here again with my freshman colleagues as we sound the call for meaningful health insurance reform in this country. We know reform is critically important and long overdue. We know reform will provide coverage to tens of millions of currently uninsured Americans. As I said last week on the floor, we know reform will bolster America's small businesses and help rebuild the economy. Here's something else we know. We must have reform that bends the cost curve and slows down the growth of healthcare costs. If we extend insurance to millions more people, but do nothing to slow skyrocketing healthcare costs, then we will not have reformed anything. We only will have added to the problem of an overburdened, unsustainable health system. And so today we stand together to offer our ideas for reducing overall health care costs. My focus this morning is on promoting good health and preventing the burden of chronic disease. Our Health and Finance committees have done a great job on this subject, and I commend them for that. I also want to make sure that when the final reform bill comes to this floor, we will not waver on our commitment to prevention. I want to frame these brief remarks around just a handful of words: nutrition, physical activity, tobacco use, and personal responsibility. Common sense tells us that smart investments to reduce the burden of chronic disease will make a huge difference, not just in the cost savings, but also in a healthier and more productive lives. Madam President, the dollar amounts are staggering. Here are just a few examples of why health reform must include substantial commitment to prevention and good health. Each year in this country, we spend $2.2 trillion on health care, and 75% of all health care costs go to treat chronic diseases, many of which could have been prevented. Each of our states is paying the price. Listen to the most recent numbers from my state, Alaska, and think again of poor nutrition, lack of physical activity, and the toll of tobacco. Alaska currently spends $600 million annually for heart disease and stroke hospitalization, $419 million for treatment related to diabetes, $491 million for medical care related to tobacco use, and lost productivity from tobacco-related deaths. We spend $477 million on direct medical costs of obesity. We need to do something, and we need to start now, in my state and in every state. We know prevention can work. Even though youth smoking in Alaska is still too high, it has been cut in half since 1995, thanks to sustained anti-tobacco funding. And I know, as a former mayor, when I came into office, we had double-digit increases in health care costs. When I left, less than 1% increase. Why? Because we created wellness programs, created personal responsibilities, and incentives for those to live a healthier lifestyle. Madam President, let's make a similar commitment in health reform this year. Let's promote personal responsibility. Let's give more American families the tools they need to take charge. Let's improve our nation's highways and transportation systems, and as we do it, let's make sure sidewalks, trails are part of the package. Let's hire more PE teachers and build upon other proven community programs. Let's save lives and save dollars by keeping tobacco away from kids. As reform moves forward, our promise is to keep it deficit neutral now and into the future. Health care reform, health insurance reform now is important. Madam President, I yield the floor.